Hello and welcome to this Bone Matters Extra session about HRT and osteoporosis. We do suggest that you listen to our first Bone Matters session on HRT, which was done back in January, and that gives a broader discussion of the issues, including is HRT safe, weighing up the risks and benefits for bones and osteoporosis. This time, we're going to focus on practical issues of taking HRT, and I'm absolutely delighted to be welcoming our special guest today, who's come to speak to us. And we have Kathy Abernethy, who is a highly experienced menopause specialist nurse, and she's going to answer some of the common questions about taking HRT. Kathy is, I must say, an absolute expert in this subject, and in fact, she was the very first menopause specialist nurse in the UK. And prior to that, rather excitingly for us, she also worked with the Osteoporosis Society way back in help setting up our first helpline, probably over 30 years ago now. So welcome back, Kathy. It's lovely to have you here.
Thank you very much, Kirsty. Thank you for inviting me. That does sound a long time ago, doesn't it?
It does, doesn't it? It's very scary. And I must also add, my name's Kirsty, and I'm one of the nurse specialists that work on the helpline here at the charity. So to start, Kathy, would you mind telling us a bit more about yourself and your career? How did you end up specialising in the menopause after originally working in the osteoporosis field?
Yeah, it's interesting, isn't it? I'm often described as an enthusiast for menopause health. And I've spent my whole working life, really, since I qualified as a nurse, in women's health, and then moved across to menopause fairly soon after that. And in fact, I had been doing menopause prior to coming to what was then the NOS and now the ROS. But I got the call to come and join you because there was a new HRT which was being launched. It was being promoted for bone health. And at the time, that was quite a novel thing for people to be doing. And so I was brought into the ROS to take some calls around this HRT for osteoporosis and bone protection. I had to move back to London soon afterwards. So job move, back to menopause. And my life just took off really in the world of menopause. And you can't avoid the fact that menopause has grown exponentially in the media in the last decade or so. And I've just moved with it.
Absolutely. I mean, I can certainly remember talking about HRT back when I started in this role over 20 years ago. And then, of course, it more or less completely disappeared. Obviously just starting to get some calls and it's coming back a bit now. But yes, it's been a real change, hasn't it, there?
It certainly has. We've seen a big turnaround for the better, really.
Absolutely. So on that point, can you, I know we've recapped, we've gone over this a little bit in the first session that was done in January, but can you give us a basic recap on the menopause, symptoms that are often likely to be associated with it, and perhaps how common they are?
Sure, and I think we probably need to start with a bit of terminology because we tend to use the word menopause as an all-encompassing language when we really mean menopause, perimenopause, postmenopause, and all the symptoms that go alongside it. So menopause itself is simply when your periods stop. Periods often don't stop suddenly, they often stop gradually, and around that time you have the perimenopause, and that's when the symptoms kick in. Menopause symptoms really do vary because around a quarter of people don't get any symptoms at all, although you wouldn't believe that because, of course, they're not the ones shouting about it. It's the ones who have symptoms who really talk about them the most. And unsurprisingly, because of those that have symptoms, probably about a quarter get quite marked symptoms. So they would describe them in surveys as being moderate to severe. What does that mean? Well, it means that those symptoms are bothersome enough that actually it affects your everyday life. So it might stop you working, it might stop you socializing, it might affect you at home with your family, for example. And when you consider that these symptoms can last many years for some people, it's not surprising that people start to think, well, actually, I'd like to do something about them.
Absolutely. Yeah, definitely. And in terms of if somebody is thinking of maybe using HRT, I can remember back from obviously old days when we used to talk about it and what we're hearing now. There are two main types that might be used depending on whereabouts a woman is in terms of the stage of life and having had the menopause or being in the perimenopause, because some menopause some HRTs, I believe you might get a sort of menstrual-like bleed with, and others you might not. So can you explain a little bit more about that?
Yes, that's right. So if you're thinking about taking HRT, it's likely to be for those menopause symptoms. So things like flushes, sweats, tiredness, maybe vaginal dryness, bladder symptoms, sometimes less obvious symptoms like memory problems, what people describe as brain fog, concentration issues. That's why you're thinking about HRT usually. And if you start to get those symptoms before your periods have finally stopped, then you're going to need a type of HRT which is likely to bring back a monthly period or bleed. That can be a nuisance sometimes, but at some point you will be able to switch to the other type of HRT. And that's when, if you've not had a natural period for a year when you start HRT, you can start one which doesn't give you a monthly bleed. And it's described as period-free or bleed-free HRT. There can be a bit of a settling in phase though, Kirsty. I would just remind that sometimes it's not no bleeding straight away. There can be an introductory phase. But the goal is that if you're still seeing periods, you'll have a monthly bleed on HRT. If your periods are stopped when you start HRT, then you probably will go on to a period-free HRT.
And just on that point, if somebody does start on a HRT to begin with that does give them a period-like bleed, how would they then know that they could maybe move on to the non-bleed one later?
So there's no hard and fast rules here, but most people, after a couple of years on what we call cyclical HRT, where you're having a period every month, after a couple of years, most people can try to switch to a no-bleed HRT. And certainly by the age of about 53, 54, if you're still on HRT then, you can definitely make the switch over. So there's a bit of trial and error, and the worst that can happen is that you have to switch back. But it is worth it if you want to get rid of those monthly bleeds and you've been on HRT for a while.
Brilliant. So women don't need to worry that they're going to be stuck like that and have to carry on. That's lovely. And in terms of the HRT products themselves, obviously there's a whole range of different types of products. We obviously know there are tablets, there are patches. I can remember talking about implants. I believe there are gels. Can you tell us a little bit more about those and sort of perhaps why choices might be made from one to the other?
Yes, we're very fortunate now that there's a huge range of products in HRT, usually containing estrogen, often containing progesterone as well, and occasionally people might be prescribed testosterone alongside it, although that's less common. So if we go back to the estrogen and the progesterone, many people will take it in a tablet form, which is a very low risk type of taking HRT, very convenient. But if you've got a medical condition, for example, maybe you're on high blood pressure medication, maybe you're a migraine sufferer, so you have migraines, maybe you're diabetic, maybe you're on thyroxine, there may be all sorts of reasons why the tablets may not be your first choice. And then there's patches, gels, there's even a spray now. The implants that you mentioned, don't use those so much these days, although they are still available. But there is a lot of choice, and the choice should partly be yours, but also it will be dictated by your health and your situation.
Right, okay. And obviously, just to point out there, and some women may have heard in the news in sort of recent months, there's been a new type of HRT that's available over the counter in the pharmacy, which is to help with certain vaginal symptoms. But just to point out, that's not going to help with bone health, is it?
No, that's really important actually. And I wouldn't really include that as HRT. That's local vaginal estrogen, which is given for a completely different reason, given for bladder symptoms, vaginal health. It won't help flushes and sweats, and neither will it help your bones.
Thank you for that. And when you start HRT, particularly if you're starting it for bone health, as opposed to women that are needing it for menopausal symptoms and obviously having that very obvious certain nudge with those symptoms to know that they need to perhaps do something. Are there any particular advantages or disadvantages about when to start, for example, starting in the perimenopause or starting postmenopausally? Does that seem to be an issue with regards to using it for bone health?
Yes, certainly the sooner the better from the bone health point of view. So if you've been advised that you might have thinning bones, or maybe you've got osteoporosis, and it's been suggested to you that HRT is an appropriate treatment for you, and that will depend on lots of medical factors, then the sooner you start it, the better, because you start to get that protection as long as you're using HRT. So you're quite likely to be on it for quite a long time, whereas somebody with symptoms may only be on it a couple of years.
Okay. And that was going to be my next question. How long might you stay on it? So, from the point of view of your role, would that be something that you would just base on the individual? Do you have any particular strong thoughts on that?
We know, and you'll have heard from your previous session, that the risks, if there are any with HRT, are with long-term use, so over 5 years, 10 years use of HRT. And anybody using HRT for symptoms tends to use it for up to about 5 or 6 years. They don't usually need it beyond that, although some do. But for osteoporosis protection, you may well be advised much longer, and the advantages to your bone health will be balanced against any small risks that might be associated with using it long term. One of the things I would say is that there's no age at which you have to stop HRT, and there's no maximum duration. So it really should come down to an individual decision with you and your healthcare professional as to what the benefits are of staying on it. And you will continue to get bone benefits at whatever age you use HRT. But also the doses, the types that you're on might be changed, because probably lower doses as you get older would be a good idea.
Right. Okay. So good to have conversations with your doctor and make sure that you're being regularly, routinely, having those discussions routinely.
Yes, at least once a year is what's recommended. You don't need to be seeing your doctor every couple of months, but you should be checking in about once a year.
And so if you've been on HRT and you have been using it for quite a long time, and for some reason you either need to or wish to stop, how would you go about that? Is that something that you would do just straight away? Do you need to do it gradually? Do you need to do it under supervision of your doctor?
Well, of course, I would suggest that you do it under supervision, although it wouldn't do you any harm if you were to just stop HRT. There's no damage done by doing that. You will start to lose the protection to your bone health once you stop HRT. And of course, your symptoms might return if you still got them. So for that reason, some people do like to come off gradually because it's less likely that those symptoms might return. But you can come off HRT very easily. It's worth talking to your healthcare professional because it may be that you could reduce dose first before finally stopping. So there's sort of tweaks that you can do, but it's very easy to come off when the time comes.
And if you do come off and you've been having some symptoms which have been nicely controlled by it, and then you suddenly think, oh, they're starting to come back, can you return?
Yes, usually it will depend whether there's been any change in your health circumstances. So your medications that you're on, for example, whether you've had any illnesses or surgery, which might dictate whether you can still have HRT. But if it's still a good thing for you to have, it doesn't matter that you've stopped and then you're going back on again.
Brilliant. So in terms of actually using HRT from a day-to-day perspective, obviously there's been some discussion in the previous section about general health risks and, as you just mentioned, those long-term issues. But are there day-to-day side effects? Are there some problems that people might encounter by simply using HRT?
Well, it is a medication and all medications can come with side effects. It will depend a little bit on the type of HRT. So, for example, if you're taking tablets, any tablets can cause a little bit of nausea when you first start them, although that does usually wear off. Estrogen, the medication that's in your HRT, can cause some minor side effects as well. Your body's not been used to having that at the time of the menopause. So it will respond to the estrogen. And a very classic symptom side effect is that of breast tenderness. And I always reassure people that it's not an indication that there's anything wrong with your breast. It's just your body recognizing the extra estrogen. So breast tenderness is a side effect. Some people get unscheduled bleeding, which can be a real nuisance. And sometimes dose changes are necessary. Sometimes you might have an allergy to the actual patch, for example. Maybe it's the glue that's in the patch. You might get a skin reaction. That can be a nuisance as well. So on day-to-day side effects, mostly they wear off by about 6 to 8 weeks of their own accord. And if they don't, we can usually tweak the HRT or change the dose or change the type of HRT to overcome those minor side effects.
Right, okay, that's interesting. And is that something, I mean, obviously you're very, very experienced in the whole HRT world. Is that the sort of response that somebody might get from the GP? Because most people probably are going to be having their medication managed by their GP.
I'd certainly hope so. I mean, obviously GPs vary enormously, as every profession does. You get individuals who are much more informed about HRT than some others. But the NICE guidance, which healthcare professionals follow, does recommend that you should have a follow-up 3 months after starting HRT. And that's when that kind of side effect discussion comes in most, because that's when you're likely to have probably got the most benefit if you're on symptoms, but you might still be troubled by the odd side effect. And so things can be changed.
Okay, that's really useful. And in terms of dosage, you did mention it very briefly earlier. Our doctors in the first session mentioned that there's not so much of an importance about dosage for bone health. And as you said, we like to try and keep people on a lower dose as possible that's suitable for them. But in terms of day-to-day symptoms, is that something that might be looked at, as well as maybe changing the actual brand of the product, trying lower doses or higher doses in terms of managing day-to-day symptoms?
Yes, certainly. We can make a stab in the dark as to how much HRT you actually need to improve your symptoms. And we've got a fairly good idea of what most people will benefit from. But there'll always be some individuals whose symptoms are more severe, and we need to increase the dose and maintain that dose sometimes for quite a long time. There is a general rule of thumb, though, that as we get older, we tend to need lower doses, particularly as our symptoms start to improve of their own accord. So as people get older, and especially as they start to get towards their 60s, if they're still on HRT at that stage, we tend to lower the doses quite a lot because we're confident that it's still looking after their bone, but they probably don't need it quite so strong doses for their symptoms. So it really is individual. If we go to the other extreme, our younger people, perhaps with osteoporosis or just with symptoms or early menopause, they usually do need higher doses simply because of their age and the fact that they miss the hormones more.
Yes, that's a really interesting point. And in terms of the sort of day-to-day practical tips, you know, you might be a woman who's suddenly found themselves given this prescription, you've picked it up from the chemist, you're going to start using it. Are there any real hints and tips there? For example, if a woman's given a patch, can she have baths? Can she shower? Can she swim? Are there points like that to notice? Or with tablets, do we need to take them at exactly the same time each day, or is there flexibility there?
There's lots of little tips and tricks, actually, Kirsty, to use HRT well. And unfortunately, not everybody does get the opportunity to ask about those tips. So, you know, for example, with patches, you do need to apply it to clean, dry skin. So if you try putting it on when you've just come out of the shower, it's clean and it might feel dry, but actually it's probably not going to stick that well because it may still be a little bit sweaty. So one example there. Another example is don't forget to change your patch, because I have seen lots of people who feel so comfortable with their patch that they forget to change it. And then, you know, their symptoms start to come back, or they start to lose some of the benefit to their bones if they're not replacing it regularly. So set a reminder maybe on your phone to change your patch. If you're using a gel, you need to pick the time of day, because you do need to leave it a good 10-15 minutes to dry. So it's no good, again, just jumping out of the shower, splashing on the gel and then getting dressed and going off to work. You do need to give yourself that time to let it dry. So it may be that the other end of the day is better for you if you've got a bit more time in your day then to let it dry. Tablets, doesn't matter if you take it in the morning or in the evening, but it is best if you try and maintain a pattern and usually do it at the same time. So yes, there are tips and tricks that we can do to get the best out of your HRT.
Yeah. And if somebody did miss a dose, if they were, you know, poorly, or maybe they were going somewhere, they weren't able to do that routine with their gel or something, is that a really important thing if they miss a dose, or can they just pick it up the next day?
So fortunately, it's probably not going to be that important, to be honest, with HRT. It's not like some medications. I would say just skip that dose. Don't double up on your dose. Just skip that day and pick it up the next one. There is a small chance you might get a bit of spotting, a bit of unscheduled bleeding, depending on the type of HRT that you're on. So try not to do that too often. But no, just pick it up and carry on when you remember.
Interesting. Okay. And in terms of the patches and the gels, swimming is, you know, those sorts of activities, are they okay?
Yeah, so what we tend to find is that the patches generally do stick really well, but there are just some individuals for whom they never stick. And if you're one of those people, you know, you can have the best patch in the world, but if your skin isn't going to take it, then you're probably better to change to a gel, for example. And that's the kind of person that when they go swimming, it always floats off. But for most people, you can swim, you can shower, you can do anything that you want with a patch on. The only thing you should avoid is a sunbed, And we know that for other reasons, it's probably best to avoid sunbeds anyway.
Absolutely, yes. And so in terms of support, if somebody's wanting to talk about HRT in the first place or is having any problems or any of that, again, like we said, most people are probably going to be managed from their GP, but we're obviously on the helpline here hearing lots and lots of people now who are finding it very difficult to get to talk to a healthcare professional at all because of the pressures on the NHS. Are there other types of support out there? I mean, obviously there are private and menopause clinics, but is that the sort of thing that somebody might be able to access on the NHS at all?
Oh, this is a big field, isn't it? Because there are definitely menopause clinics available on the NHS, but not everybody needs to go. Most people don't need a menopause specialist. Most people will manage with their GP. And my advice is that GP is always the first point of contact. It may not be the GP itself, of course, him or herself. It could be a nurse practitioner or an advanced nurse practitioner. Could even be a pharmacist now because they have special training as well. But the GP practice is usually your first point of call. There are websites as well you can go to, and I would encourage anyone that's looking at websites to just check who it's written by. Are they trying to sell you anything? Is it up to date? Where does it originate from? And you can do that by looking at the bottom of the web page to see who it's supported by, for example. And there's some really reputable ones that we can suggest, like Daisy Network, for example, which is for those going through menopause under the age of 40, Women's Health Concern, which is the patient arm of the British Menopause Society. Those are good places to go and be sure that you're getting good advice.
Absolutely, yes. And we do often recommend those when we're talking about this on the helpline, so they're good to know. I think that's probably the end of our questions, but that's been such a whiz through some really informative information. That's incredibly helpful, Kathy. Thank you so much. Really appreciate you taking the time to come and talk to us today. I don't know if there's any points that you want to add at all. Do you feel that we've covered everything?
I think we've covered quite a lot, Kirsty, but thank you for having me.
Oh, that's been absolutely brilliant. Thank you so much, Kathy. And thank you also to all the ROS members out there who have submitted questions for today. We do use those to guide content on any of our Bone Matters sessions. So thank you for that. Please do look at the resources that we've put on this topic in the description below the window you're watching us in here. And also, if you can spend a couple of minutes, please do give us feedback. This really does help us guide any future Bone Matters sessions. And again, you'll find the link to that in the description below. So once again, I can only say thank you so much to Kathy. That's been absolutely fantastic, really useful information. And thank you to everybody out there for watching. Thank you.
Bye-bye.